Welcome back to the Humble Healer podcast. And I hope that everyone has had a good 4th of July celebration, spending time with your family, cookouts, and enjoying some fireworks. So I'm very grateful for this country. And I've been here for 36 years and have been able to live my American dream and feeling very fortunate. And yeah, it's not perfect. And I know that. And there are things that we can do to make it better. But I'd rather be here than anywhere else in the world. And it has its values that. Uh, so happy birthday, America, 250th birthday. And thank you for all you have given me and my family and allow me to have and build my own family and to live my American dream. For that, I'm grateful. So today, we'll talk about part two of the latest fat diet, FAD, fat. And the previous episode 73, 2 weeks ago, I talked about carnivore diet, which is, for me, is a no-no for your health. And also paleo diet, which has more health benefits, but also has its own downside and difficult to maintain in the long run due to its complexities and also highly heterogeneity in terms of its characteristics. So, and today we'll talk about intermittent fasting. And today there are types of intermittent fasting, say 5 and 2 days of very low calorie diet, less than 500 calories a day, or even water. And certainly those diabetic patients or other patients with some endocrine issues should be careful about this and consult with your healthcare providers to before attempting this diet. And also 5 days of regular of the diet that you normally do. And the advantage is that you don't have to alter your shopping habit, perhaps just spending less money, which is these days very important. And the key is to learn to deal with hunger. And I tell my patients all the time, hunger doesn't kill you for most people, and it's in a way allow your body to reset and help get rid of the toxins. And from what I understand is that the more we eat, the more we have the processed food in our system, and we generate what we call oxygen radicals too, which can be damaging to our systems and cells, and hence overconsumption of food, especially unhealthy food, can be damaging for you in the long term, other than the fact that it causes weight gain and multiple other effects. So eat just the right amount, moderation, do not overconsume. You see that in the Bible. I think that Christian Bible, one of the 7 sins is overindulgence in food, and I think that's a good point. Is that it helps. It actually teaches you to be healthier. In the Buddhist teachings, the monks only eat once a day on nutritious, healthy vegetable food, and that's enough to sustain themselves. And they have bowel movement only once a week, for example, so they generate a lot less waste and oxygen radicals, and hence they lead a very healthy lifestyle. The Muslim followers, they have the Ramadan in a way to show respect and honor Allah, but I think that it does have that health benefits for its followers because it does reduce. It's a form of intermittent fasting when you think about it. So the common theme is that these diet, intermittent fasting, and they have benefits for the people that practice if you do it the right way and stick to what you set your goal to. Um, and you can also create a crescendo method. So you can fast from 12 to 16 hours daily. And so that way you consume any food without limitations. The challenges is that it's difficult to sustain long term. And also initial weight loss can plateau quickly. And sometimes it can be socially isolating and hard to maintain during life events. I mean, you really have to plan it well. For example, if you have a big birthday party tomorrow or a party or wedding, perhaps try intermittent fasting the day after or the day before. And even if you set your day to be Monday and Thursday, maybe you have to change that. So debunking myths here is diabetic patient should not use intermittent fasting. It does increase the risk of hypoglycemia, which is low sugar, and ketoacidosis also. In non-diabetics, blood sugar stays regulated through normal insulin response. There's minimal added benefits. So definitely diabetic patients should not do this diet. So that's the up and down of it. And the key is that whatever diet you use, make sure that you stay with it, sustainable, just like exercise. That's my message throughout any sort of healthy lifestyle. The next one is ketogenic diet. Ketogenic originally designed for epilepsy and still used clinically under supervision for neural disorders. And it shifts metabolism from glycolysis to ketogenesis. So the high fat and low carb. And there's a 4-to-1 ratio between fat and then carb and protein is only 1. And there are some short-term benefits. Unlike carnivore diet, ketogenic, if you do the right way, has weight loss without lipid profile elevation. It follows strictly. The recent side effect is hypoglycemia due to carb restriction, low sugar, GI symptoms such as nausea, diarrhea, reflux, vomiting, and also some nutritional deficiencies, low in fiber, low in folic acid, fruits and vegetables, and also considered unsafe in pregnancy. For those in the urgent care setting, people that come in with recurrent hypoglycemia or vague GI symptom, ask them about their restricted diet to see the ketogenic diet or even the intermittent fasting. So bottom line is that it's to stay away when you're pregnant, of course, and you may be at risk for hypoglycemia, especially diabetic patients. So not highly recommended in that population. And watch out for those patients showing up in the urgent care clinic with recurrent hypoglycemia. Next diet is detox diet, which include lemon, cayenne, maple cleanse. This is extreme calorie restriction, no food, only fluid intake, often combined with laxative or saline-induced diarrhea. It doesn't sound very healthy and certainly not sustainable. And you shouldn't sustain this because its overall long-term health effects is not very good. And the risk is hypoglycemia, dehydration, and electrolyte imbalance, even syncope or passing out. It can cause rapid weight regain after resuming normal intake with a nutrition depletion. So we discourage this strongly and advise patients to stop immediately if reported due to both short and long-term effects, adverse effects. So bottom line, intermittent fasting and ketogenic diets may have neuroprotective effect benefit, but are not safe or sustainable for most patients, especially those with diabetes. And the carnivore diet and detox diet pose significant health risks and should be strongly discouraged. And for those with GI complaints such as nausea, vomiting, diarrhea, hypoglycemia, low sugar, and unexplained symptoms about recent dietary change should be inquire about what diet they are using, because a lot of times that's the reason why they have those symptoms. For sustainable weight loss, encourage realistic, so balanced changes that are maintainable long term. In the next episode of this series, I'll talk about Mediterranean diet, which is not a fat diet, FAD, and it's the diet that has the strongest scientific support and evidence to support the use of that, and also favored by cardiologists. And we'll tell you what they are and how they are helpful. Interestingly, this diet is very similar to the diet that adopted by the 2 or 3 populations that have the highest concentration of centenarians in the Netflix series called the Blue Zone, and in Okinawa and Sardinia, Italy, and also an area in Greece, which I don't remember the name of that region, but 3 regions that use this kind of Mediterranean diet that allow or contribute to longevity of this population, one of the longest, highest longevity in the world. So we'll talk more about that diet, and so it's good to know about that. And the bottom line is that whatever method you use, I hope that you make it sustainable and make sure that you like the food and the diet too, because that's also an important determining factor for maintaining it long term. And don't forget to incorporate other factors into this wellness besides diet, exercise and doing the stress management and so on. So let me know any feedback. Hit the like button if you can. Subscribe to the channel, and let me know what diet that you like and what works the best for you. Thank you so much, and have a good Sunday, everyone.